Arthritis sucks. It's a pretty blunt and simple way to introduce a video. When you get diagnosed with a chronic illness, you know, that's lifelong and incurable, you know, you tell the people who are nearest and dearest to you, you tell your friends, you tell your family, you tell your colleagues, and they all react differently. Don't get me wrong, 9 times out of 10, you know, the responses of those of support and those of encouragement and those of love, which is obviously always appreciated, especially during your down times and your bad days. But you do get the odd idiot that, not necessarily idiots themselves, but the comments that they make are pretty stupid and idiotic. I've had quite a few of these since I got diagnosed just under a year ago, so I decided to do a video about it. I have decided to do 5 things not to say to arthritis sufferers, but with some of these you can kind of, you know, use it for all chronic illnesses. Have you used this cream, that lotion, that magic pill? Not long after I got diagnosed with psoriatic arthritis, someone from work immediately came up to me and started to talk about this vitamin or something that I should take every day, and it would immediately reduce the pain in my joints. I mean, it was sweet of her to try and help, and, you know, I appreciated it, kind of. But these magic vitamins and herbal remedies that you see on TV and you see online, they do not work. They can't work. They do not cure like they claim to, because arthritis is an incurable disease. There's controlling the disease, but there's no way it can be cured. Besides, if they did what they claim to do, you wouldn't be able to buy them by the bagful online. You would have to get them by prescription and be given them by a doctor. If a doctor doesn't recognise it as a suitable treatment, then surely you shouldn't trust it either. Taking all this medication is bad for you. What? Surely not taking the medication would be much worse for me than taking the medication. I mean, I can kind of see what their point is that they're trying to make a big thing of medication has side effects, it can mess with your body, etc, etc. But every single medication that is out there comes with a risk, it comes with side effects. It's what is to be expected, but they do what they need to do, which is to control the disease and reduce pain, which is, let's be honest, nobody likes to take medication, whether it's daily, weekly or a monthly basis, but it's something that we have to do. As for the amount of medication, you get it from your doctor, who's a professional. They know what they're doing, so if the doctor tells me to take a certain dose, I'm taking that dose. I don't care what people think, or it's just one thing after the other with you, isn't it? Yeah, it is. Don't state the obvious. For those who have arthritis, we all know that there are multiple problems with having this condition. More than one joint can be affected. There can be disease complications, and there can, obviously, like mentioned before, there can be side effects of the medication. For me personally, it's mainly my back, my hands and my knees, but I also suffer from fatigue really bad. I'll have days where it takes me up to an hour to get out of bed. Not just to do with my joints, just the fact that I can't physically get up, which is a terrifying thing. But I tend to drop things, and I'm a lot more clumsier than I used to. I have lost count how many times I've dropped my phone and other people's phones. Sorry, Net. But all these problems that I do have, they all stem from arthritis itself, and to be honest, the list of problems vary from person to person. So yeah, it does kind of seem like one thing after the other, but you really don't need to tell us. We're well aware. We're living it. You're too young to have arthritis. Try telling my joints that. There is this huge misconception that only people of an older age can have arthritis, and this is totally untrue. I mean, yeah, people of older age are more liable to have arthritis because their joints are weaker, they've obviously been used more, and they're more liable and prone to damage and to break. But people of a younger age can also have the same thing. The most common age for diagnosis for arthritis is actually between the ages of 30 and 50, so it's a lot younger than what people think. But there are many people, like myself, that got diagnosed in their 20s. There's other people that have been diagnosed through their teens, and even children can have arthritis. It's a massive misconception. I mean, I had pain in my joints since I was about 15. I didn't actually get diagnosed with having psoriatic arthritis until I was 21 because my old doctor thought I was too young to have arthritis. Why did I change doctors again? The mind boggles, it really does. The absolute worst thing you can say to someone who has arthritis or any chronic illness is, well, you look fine to me. This one got to me when I told someone else at work about my condition and they didn't believe me. They genuinely thought I was faking it. I mean, if your joints don't look like this, then it is really hard to, you know, look and spot and point out someone that has arthritis. That's why it's so damn difficult to diagnose. I mean, just because we're smiling and we're having a laugh and we're getting on with things, that doesn't mean we're not suffering. I'm well aware how depressing that sounds. For someone who's tired of the feeling of being sick and tired all the time, the comment kind of implies that, well, you look good, so it can't be that bad, can it? A lot of symptoms of any long-term condition, whether it's arthritis, diabetes, anxiety, depression, Crohn's, any other disorder, a lot of the symptoms are invisible to the human eye, but they're still very, very real. Pain, it's not always visible, okay? Fatigue is not always visible. So much of the problems with arthritis and other conditions, they are not visible. They are there, believe me. Actually, quite a few people said that to me, and it kind of annoyed me. I don't know if it was some people just trying to spur and try and make me feel better by just going, well, you look good. So yeah, that's great, thanks. You're probably blind. But, you know, I don't know. I don't know if it was just me personally that finds that insensitive. But I think a lot of it is just pretty much misunderstanding. So, yeah, I think that's, you kind of have to take some comments like that with a pinch of salt, but that's the comment that annoyed me most, and I've also heard that it's annoyed other people quite a lot as well. Thanks for watching this video. I hope you liked it. If you did, give it a thumbs up. I kind of just wanted to do that because I was watching other YouTube videos about people with arthritis, whether it's psoriatic, rheumatoid, osteoarthritis, etc. And I noticed there weren't actually that many videos talking about it or talking from the perspective of a sufferer. So I thought I would do this just because it's something different for me. If you like me doing these top 5 lists, I might do some more. Even make some suggestions of any more top 5 lists. I will attempt to do them. But yeah, I think that's pretty much it. Take care, guys, and I will see you next video. Bye.